team uses the latest research to decide when it is safe to return to sports after an injury.
What sport do you play? Soccer.
We have selected specific functional tests to help predict who is most likely to have another injury on the same or opposite leg.
Today is a Y balance test, a drop jump test, and then a single leg squat endurance test. So it's a combination of...
Your provider will determine the earliest date you are able to schedule a functional testing visit. These visits are scheduled to allow plenty of time for testing and discussion. Athletes who are most successful with this testing have followed guidance from their healthcare team, which often includes a physical therapist and/or an athletic trainer. Today we will introduce you to each of these evidence-based tests. Y balance test, drop landing test, and single leg squat endurance.
So what I'm going to be taking is a leg length measurement. I just want you to go ahead and bend your knees up for me.
A short physical examination and interview will be performed first. This includes questions about your rehabilitation, leg length measurements, and ankle range of motion.
So I'm going to get... The purpose of the test is to be able to stand on one foot while you utilize the opposite leg in these nice red target areas of the blocks.
The Y balance test is performed on this equipment. Standing on one foot, you will be asked to slide a box as far as possible in 3 different directions. You must return to standing under control. You will remove your shoes for the test, and you must position your foot exactly as directed.
Use your left toes to push the block, and your toes are only going to go in that red target area. All right, so do you know why that maybe doesn't count?
I flicked.
You flicked it, so it doesn't count on the actual test.
There are a few unacceptable
Okay,
movements that will disqualify an attempt. These are touching the ground during the motion to recover your balance, forcefully pushing the box at the end of the movement, placing your foot on the rail, and your toes may not rest on top of the block. You will be given 6 practice attempts for each movement on each side.
Very good.
You may ask any questions during the practice session. When the testing begins, the tester will record the best of 3 attempts for each movement on each side. You may ask questions during your practice. Keep your reaching legs straight so that you can push the block as far as you are able.
Very good.
Take your time. Ask for a rest break if you need it. Do your best on each attempt.
All right, 57 was your best, so we'll go ahead and move on to the next leg. Go ahead and stand on your left leg. Use your right toes to push the target as far as you can and return under control.
This test measures the quality of the athlete's ability to jump and land with proper knee position. Using the LESS landing error scoring system, the tester will score different aspects of head-to-toe movement.
Great, so I'm gonna have you line up with your feet right at the front of the box, and you're about shoulder width apart, so narrow it up just a little bit. Perfect, okay. So what I'm gonna have you do is jump down into the pink and then jump up and try to touch the ceiling for me, okay?
Standing on a 12-inch box, the athlete is asked to jump forward off the box onto a target on the floor and immediately jump up to reach for the ceiling. There is a short practice session first. Then you will perform the jump 4 times while the tester observes or makes a video recording.
Really good.
This test is designed to mimic the fatigue you may experience in sports.
Go ahead and put this around your waist, okay?
You will perform a single leg squat while facing a mirror, standing on one end of an elastic band, and holding the other end of the band in your hand.
Nice job.
The tester observes your ability to maintain proper hip and knee position while you are getting tired. A score is recorded for your performance at each minute. Sit your hips back like you would sit in a chair. Don't fully extend or lock your knee when you come up. Keep your hips facing straight forward. Keep a pace of 1 second going down and 1 second coming up.
And sit your hips back a little bit more so your knee doesn't come forward. Good job.
When you have completed the testing, it will take a few minutes for the therapist to compile and evaluate the results of the physical exam and the standardized tests. This analysis includes looking at one leg compared to the other, as well as your overall performance compared to other athletes of the same age, sport, and leg length. The therapist will provide instructions on exercises that will help you address problems noted in the testing session. Together, the therapist, provider, and your family will decide the best time to return for testing again. We encourage you to take our recommendations seriously so that you will reduce your risk of injury and improve your chances of successfully completing the functional tests.